Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. And as always, today we are taking your COVID questions. Today is Tuesday, April 27th, and we've got a lot of data to look at, and I'm sure you have lots of questions. So as always, you can put them in the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We'll start with looking at data, chicago.gov/coronavirus. That's your one-stop shop for everything related to COVID in Chicago. And if we go to the dashboard, chi.gov/COVID- and pull it up, so you can see some really continued good news here. The thing we're most pleased about is that current positivity rate. It's the first day, we're at 4.9% as of last night. And a week ago, we were at 5.4%. Our goal, of course, is to be below 5%. So it's really good to see that coming back down into the range where we want it to be. Similarly, our testing actually remains quite good. We're averaging about 13,200 tests a day. That's down about 6% from a week ago, but still well above where we need to be and generally holding quite well there. And then finally, our case counts are also really dropping nicely. We're at 548 cases per day, new cases on average, down from 660 a week ago. That's a 17% drop. And if we take a quick look over here under demographics, I'm going to just change this so we're only looking at the last couple of months or so. And if we look at the age grouping of this first, and I'll blow it up so you can see. What you see is that on top here, the red, the blue, and the yellow lines, those are people, red is people 18 to 29, blue is people in their 30s, yellow is people in their 40s. You can see that really people 18 to 49 now are all having about the same rate. So we are seeing most of our COVID cases still concentrated among younger Chicagoans, but have seen that drop off in the very youngest Chicagoans really quite nicely. And now equally, we are seeing cases among those in the 18 to 49 range, which of course is also the group that we are most trying to get vaccinated. New eligibility and wanting to make sure that this group's heavily vaccinated. If we look a little further down here, in the middle here is the people in their 50s, and then in blue is children. You can see that's been dropping really nicely along with all of the other age groups. The only thing I'm concerned about is this gray line down here. These are people who are over 80, and there's not very many of them in Chicago, but do you see how the case rate is actually going up a little bit among people in their 80s? And we're seeing a higher rate of cases in people in their 80s than we are people in their 60s or in their 70s. So, you know, this just worries me a little bit because the people in their 80s are by far the most likely to have the severe outcomes from COVID, to get hospitalized or to die. And so if you know anybody, anybody in Chicago broadly, we're trying to encourage them to get the vaccine, but especially if you know anybody over 65 or especially over 80, please, please reach out, help them get the information, help them get to a vaccine site, make sure they're signed up for our homebound program. Really need to get those most vulnerable folks vaccinated. And if we go back here, and instead we're going to take a look by race ethnicity, and I'll blow it up, same thing over these last couple of months. Actually, you know what? I'm going to just make it so that we're only looking at the major subgroups. We're just going to do Asian, Black, Latinx, and white. And if you're interested in more details, you can look yourself. So if we look at this, so purple represents Black or African American Chicagoans. Blue is Latinx. Red is white, non-Latinx, and then green is Asian, non-Latinx. And what you see is that just like we've seen for the last couple of weeks, our highest case rates still are among Black Chicagoans. But you can see that starting to downtrend, which is good. Followed by Latinx Chicagoans, which is really decreasing very nicely. And then in red, we have white Chicagoans decreasing nicely. And then green Asian Chicagoans. Teeny bit of an uptick here these last couple of days, but there are many fewer Asian Chicagoans. And we see this move around a little bit more with some changes. So we'll keep an eye on that. But broadly, very pleased to see these decreases across all race ethnicity groups, but still seeing higher rates among Black Chicagoans. And really the number one reason for that is just that our vaccination rates are also the lowest among Black Chicagoans. So I thought I would just take a minute. If you're not used to looking at our vaccination side, you can go to chi.gov/COVIDvax. Oops, sorry. Kovid VAX. And first, I just wanted to highlight there's a lot on here, and you can, if you're interested in finding a vaccine, this is where our vaccine finder is. This is where you can sign up for homebound. This is where you can sign up to be on a wait list for a site near you. We've got information about our city sites here. We've got information for different groups, for individuals, essential workers, seniors, those with underlying conditions, employers. We've got information here for providers who really remain at the center of our strategy. So we've been pushing vaccine out to any provider that has been requesting it at this point. So the goal is to get this into doctors' offices, obviously pharmacies and others. And this is information for providers about what they need to know. There's some information here about Protect Chicago Plus, our continued work on equity, a lot of resources, including frequently asked questions, ways you can volunteer, communication tools, vaccine basics, FAQs, and then various updates. But on the right here is our data. So there's lots on here, but under data at a glance, I just wanted to highlight, if you've not looked at this recently, we've updated this so every single day you can see how are we doing. So here you can see all Chicago residents, 43% have gotten at least a first dose, and 28.5% have completed their vaccine series. If we look just at adults, 18 plus, that's about 54% have gotten a first dose, and about 36% have completed the vaccine series. And both of these are good. They're on track or ahead of the state and the rest of the country. However, our 65 plus numbers are still lagging. We've got 65.1% of Chicagoans have gotten a first dose, and 53.8% have completed their vaccine series. And this is the one metric that we're behind on here in Chicago. If you look nationally, this is at over 81%, nearly 82% of people, Americans over 65, have gotten that first dose. So again, this is the group I'm the most concerned about. And we've done a lot of work, and I'm happy to answer questions and continue to do work and outreach. But if you know anybody over 65, especially concerned about getting these people vaccinated, our numbers are looking good, right? We're going to be at a point here where we'll be able to do some more reopening. Things are really looking promising, but getting the most vulnerable folks vaccinated, especially those who are older, and then especially those who have underlying conditions, is critical for us being able to be open and do that safely. So that's my one concern. And then if we look by race ethnicity, you see here that if among white and Asian Chicagoans, 48 to 50% of all, and that's not just 18 plus, that's everyone, have now gotten a first dose, which is good progress, but still a ways to go. But then you can see about 34% of Latinx Chicagoans and about 28% of Black non-Latinx Chicagoans have gotten that first dose. So really a ways to go there. And a lot of our additional outreach work, work of really bringing vaccine to neighborhoods that are heavily Black and Latinx, obviously moving to the walk-in, and we can talk about more of the creative strategies we're doing there. But this is where you can track how we're doing generally and then compare that to what's happening nationally and across the state. Here you can see also what's been happening every day. We update this. The black line is how many vaccines have been given in Chicago. The blue line are first doses, and then the green line are second doses, people that have completed. So you can see we've seen some drop-off in first doses here, and that's really what's reflecting across the board. Some of that, I think, was with the Johnson & Johnson pause. So with that coming back online, we're pleased that the decision and the recommendation by ACIP was to again start using that vaccine, and we have started using it, and we can answer questions about that. But we have a long way to go, and I really want to see, especially this blue first dose number, ideally ticking back up, because we now have enough vaccine for everybody for the first time. And then this is where you can look both by race ethnicity and then by age and get a sense of how we're doing. So you can see, rates are going up nicely across all race ethnicity groups in Chicago, and you can hover and see what the rates are in terms of coverage in a given day. But particularly in the blue and then the purple here, representing Latinx and Black, we have a long way to go. So that's a major focus. And you can look here if you want to see what our completion rates look like. And then this is related to our allocation, our efficiency goals. And as you might recall, we set some really aggressive efficiency goals here. We said every single week we want 95% of our vaccine out the door, 2 providers, 2 appointments, and we have literally hit that goal every single week since our vaccine efforts started, including last week. 98% of our allocated doses were able to be distributed. Looking at the current week, though, I do expect that's going to fall a little bit because we are hearing less demand. We are hearing providers say that they have enough vaccine. And what's helped with this partly is that the federal government is now directly giving vaccine to pharmacies and directly giving vaccine to federally qualified health centers, which have been very central to our strategy to really reach into neighborhoods here in Chicago. And so now that they can get unlimited vaccine doses directly from the federal government, we have more ability to have some flexibility here, but it also means that we may not hit that. We'll see, but we have continued to. And then similarly, our goal of trying to have at least 85% of vaccines in arms within a week. Last week, 7 days after delivery, 88% had been administered, so we were hitting it. But I think based on a little bit of what we've seen this week, we may drop below for the first time that week, and that is partly a reflection of it's a good issue where we now have enough supply, but the question is, will we have the demand to really keep up with the supply? And when I look at the news coming out of India, we can come off of this now, which is having just a terrible COVID surge. They've been breaking records. It's such a populous country and it's not a very strong healthcare system. And so unfortunately, they're seeing the most COVID cases at this point that have ever been diagnosed in a given day. They're beating how many the US was ever diagnosing at our peak. And we know because of limitations in testing infrastructure and healthcare infrastructure that there are many more people who have COVID and new COVID than are actually being diagnosed. And so there's been this indirect work where the crematoriums and the morgues are just completely overloaded. And in a setting where they have so many people to vaccinate and only about 10% of the population vaccinated. And so there's been work. I saw that the U.S., the federal administration, is sending supplies. I mean, they don't have oxygen. They don't have enough hospital, supplies for these folks who are seriously ill, but also some supplies to help with vaccine production there, because you see when you're having this surge just how important having a highly vaccinated population is. And I'm worried about it because when you have unfettered spread, not just in India, but that's one example, that's also the setting where you're seeing variants emerge so much. And so, I obviously am first and foremost focused on Chicago and getting Chicago vaccinated, but us being able to quickly get vaccination done here, have people make that decision, get their vaccine, get us protected in Chicago, in Illinois, across the whole US, that actually opens up our ability to do more of this vaccine diplomacy, really share vaccine with countries around the world that may not have as many resources and don't have as much vaccine. And doing that in turn helps protect Americans, because it's the settings where you see this unmitigated surge that variants are most likely to emerge, and then in turn those can end up being a problem for us down the line. So I'm feeling really grateful about the fact that we have enough, right? We have enough vaccine here in Chicago. That's not true across most of the world, and it was not true in Chicago in just a few weeks, until really the last week or two was the first time we could say with a straight face, we have enough vaccine, and we need Chicagoans to make that decision to take it. And we're doing a lot of creative work. We actually have a press conference at 1 o'clock today where I'm going to be detailing a lot more about some of that. But okay, let's go ahead and turn to some of your questions. Okay, so all right, so I see lots of you are chiming in already about the new CDC guidance that's saying that fully vaccinated Americans are able to go without masks outdoors except in crowded settings. And we'll put in some more details about what that means. This is really, I was in some conversations about this, I will let you know. And the point here in everything as we're moving ahead is that when you are vaccinated, that is the big difference between whether you are at significant risk for COVID. And so what's different about the fact that, yes, we still have almost 550 new cases of COVID every day. That's high risk in general. The way we've already thought about COVID, it means that when you're gathering in a setting, there can be a significant risk. But the thing that is different now is that that risk is completely bifurcated on whether it's a highly vaccinated setting. If you are in a highly vaccinated setting, if you yourself are vaccinated and the great majority of the people around you are vaccinated, the risk of you getting COVID, even with 550 cases in Chicago, is very, 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 very low. Whereas with 550 cases of new cases of COVID in Chicago every day, you're in a setting that is under-vaccinated or unvaccinated, and you yourself are not vaccinated. In fact, your risk is going up because that risk is getting concentrated in the parts of Chicago that are less vaccinated and in some of those populations and geographies. And so with the CDC really recommending at this point that crowded outdoor settings, right? Places where you can't keep that distance, those still pose some risks. And so they're recommending that if you're attending a sporting event or a live performance or a parade, that those where you're crowded and you kind of can't keep some distance right now, really recommending that folks should keep that mask on. But broadly, otherwise, if you are fully vaccinated, 2 weeks post that second dose, going without a mask outdoors makes sense. And that outdoors generally remains much, much lower risk. And so we can see what other questions people have there and come back to that. But that is definitely new and exciting news, and I'm glad to see it. So yeah, we're seeing some questions here about outdoor gatherings, et cetera. So so recommending here that fully vaccinated Americans, we got almost 100 million people, by the way, who are fully vaccinated in the U.S. More than 230 million that have gotten a first dose, but almost 100 million fully vaccinated. And for those who are, you can attend an outdoor gathering. You can attend outdoor restaurants. You can do all of this. So it's exciting. Okay, I'm just seeing all the different things coming in here. So Tiffany Hagstrom on Facebook is asking, what about the P1 variant makes it more virulent to younger people, for example, in China or Brazil? So the P1 variant is the one that emerged, originally was first detected in Brazil, and it's one of the ones that we're seeing more of here in Illinois than in a lot of other states. And the scientists are still learning about it, but basically one of the things that's been concerning is especially people who have previously had COVID, we're seeing more rates of reinfection broadly in Brazil, for example. Here in Chicago, where we look at the people who have had P1, it actually has not been presenting particularly differently. So the team does additional investigation whenever we detect someone with a variant. And I can tell you that the people who have been having the P1 variants actually have not traveled internationally. So we know that these are coming in just from elsewhere. We know we've had multiple introductions, so it's not like there was one person with P1 who then spread it across the city, and we've seen it in a few different locations. But we've not at this point seen those people be more likely to have had COVID before or more likely to have already been vaccinated. They're also not more likely to have been hospitalized. And so generally, again, as a reminder, all of the variants, including the P1, all three of the vaccines that we have do remain broadly protective against them, and you need to get vaccinated now as your best protection, as well as if you're in a setting of concern, making sure that you continue to wear that mask. Melissa Schmezkal on Twitter, any update on Pfizer getting approval for kids aged 12 to 16? It's actually 12 to 15. So yeah, great question. So let's just kind of take a quick step back. So right now, Pfizer is the only vaccine that is approved for children age 16 and 17. The Johnson & Johnson and the Moderna are not yet approved for anybody under the age of 18. And that's just because that's who the studies were done in. Pfizer included 16 and 17-year-olds in their study, and Moderna and J&J did not. So the only vaccine 16 and 17-year-olds can get right now is Pfizer. Pfizer is the vaccine that the city of Chicago right now is using broadly in its pods. If you go on ZocDoc.com or you call our vaccine line 312-746-4835, most of those appointments will be for Pfizer, and all of our pods are open to 16 and 17-year-olds. Pfizer has already submitted its information to the FDA for the part of its study that was looking at 12 to 15-year-olds. And that data looked really good. It's not just about did they get COVID. They looked at the antibody levels, they looked at side effects, and the vaccine performed, and in fact even outperformed the level of protection that they were seeing in young adults. So the good news is that because this vaccine already has an emergency use authorization and is the same vaccine at the same dose without any change in how it's being administered, the FDA does not need to pull together its external committee again. So I am hopeful that the FDA in may give that green light to the extension for being able to give the Pfizer vaccine all the way down to age 12. We then need the CDC, and specifically the Advisory Committee on Immunization Practices, the ACIP, to weigh in on that, because they are the ones that make the recommendations about timing, and who exactly to give it to. But I'm hopeful that this will be coming, maybe very soon here. We are already doing a lot of planning around what it will look like to vaccinate the adolescents, the 12 to 17-year-olds. And I'm also really excited and hopeful that fairly soon that same thing will happen for Moderna and or J&J, because the Moderna and the J&J are so much easier to use because you don't have to have the ultra cold freezer. You have a longer time once they've been taken out of the freezer to use them. They're really much better for pediatricians' offices and school-based clinics. And so we are watching all of these. And there are already trials that are going on for younger kids, including very young children. So I don't know for sure. The science has to be done, and then the approvals have to be complete. But I am expecting, certainly this summer, I expect that we will be vaccinating children as young as 12, and we'll be setting some goals of trying to get highly, highly vaccinated before coming back to school in the fall. And then if I had to take a guess, I would think probably this fall would be when we might be vaccinating children, maybe between 6 and 11. That's a total guess, though. It's going to depend how long the trials take. But I think it'll be sort of a fall-winter sort of situation when we're doing those younger kids. And then my guess is that the vaccine will be approved for the youngest kids, and that may be a group that we're thinking about in early 22. That's just my guess, though. But I'm feeling confident because we've already seen data for Pfizer that hopefully, possibly as soon as May, and certainly this summer, we will be vaccinating adolescents. Okay. Mark Rakovich on Facebook. I'm a Chicagoan currently abroad as a foreign correspondent. I'm scheduled to return in June. Will I still be able to get vaccinated? Yes, you will. And thank you for that question. I love that you're watching that from wherever you're watching it. So our vaccination efforts are not going anywhere. The vaccine will continue. It's increasingly going to be moving into more of these neighborhood-based centers. Obviously, we worked hard here in Chicago to develop a network of more than 600 providers that have already, they receive vaccine. These are your local pharmacy, your doctor's office, your urgent care center, plus all of the more creative work we'll be doing to bring vaccine. And you've heard me say this before, it's going to be more like getting a flu shot. It's not going to be, can I get a vaccine? It's just making that decision and getting it done. So yes, the vaccine will definitely be available in June and indefinitely, but we want folks who are not traveling internationally to get that vaccine right now. Richard Benson on Facebook, thanks for the shout out. He says, just got his Pfizer shot at Wrigley Field, very well run, in and out. Thanks for having an accessible location for those of us without cars. Yeah, so we've thought a lot about how to have, most of our sites we've thought about, are they near public transportation? Can you get there if you don't have a car? I know I'm seeing some other ones from people, I want to have the drive-in. So the drive-in is now again open at Chicago State with Johnson & Johnson vaccine. You can go on the website if you want to to sign up, but you can also, just like we have walk-in without needing an appointment, we have limited drive-in availability, even people who don't have an appointment. But I would encourage you, call 312-746-4835. It is not a long wait to talk to somebody on the phone. We've got it really well staffed. And the group on that phone line will talk to you about where you live, what kind of transportation needs you have, and then make sure that you can get an appointment. One other just note, there's some good news related to Uber. So if you are on ZocDoc.com/vaccine, right, the #1 place where you go to get an appointment, any of the City of Chicago locations, the ones that say Protect Chicago on the side, and Wrigley Field, if you need help with transportation, getting to one of those sites, you click the box that says, I need help with transportation, and when your appointment is confirmed, it comes with a whole range of options, including, thanks to Uber, free codes and directions that will get you to and from any, if you're a Chicago resident, any of the City of Chicago pods in Chicago. So if you need a ride to and from the United Center, you can get one for free through Uber. If you need one to Chicago State, if you need one to Wrigley Field, if you need one to the Daily Center, or really any of the sites that are the City of Chicago sites. We also give out free CTA cards. So if you get yourself, for example, to the United Center, someone drops you off, you can get a free CTA card or a PACE card. We try to do everything we can to work on transportation there. And if you're going to get a vaccine, please bring a friend. Is there anyone you can call, anyone you know, especially if they're older, but even not? We really want to get everybody vaccinated. Okay, Pam Petrowski is asking, is there information in Spanish about local vaccination access that can be shared on social media? Definitely there is. So go to chai.gov/COVIDVax, and there's, over on the right, there's downloads and sort of social media tools that people can use, and there's a lot of it available in Spanish. And we would love you to be posting some of this in Spanish or English. Like if you're interested enough in COVID to watch this, and you're watching it, most of you through Facebook or Twitter, please, use that platform to share good news about vaccine, and especially access about vaccine. Vicki Hamilton on Facebook, how safe is the vaccine for the unborn child of a pregnant woman? So this was also something that we got new news on just this week, and good news. So recommendation, as you know, there were not women who were pregnant who signed up for the vaccine trials. There were some women who became pregnant during the course of the trials, but that was not the group that the trials were initially done in. However, there have been more than 35,000 people have been vaccinated and then signed up through vSafe, which is the optional CDC tracking for anybody who has had a vaccine. You can report your symptoms, you can report any issues that you have. And so there were more than 35,000 people who were pregnant, who said, I'm pregnant, and told vSafe. And not only have they been tracking those outcomes, the CDC did some follow-up and called anybody who had reported through vSafe that they were pregnant, got a lot more information about their pregnancy and their prenatal care and their pregnancy outcomes. And there was just a paper in the New England Journal of Medicine this week on the 21st that found that there were not safety signals among people who had gotten the mRNA COVID vaccine. So about half had gotten Pfizer, about half had gotten Moderna. They did not see higher rates of miscarriage. They did not see higher rates of birth defects. It's a relatively lower number of people, but really the news very good there in terms of that this is what was assumed, but really bearing out in the data, not seeing risks, at least in the studies to date, that link receiving the COVID vaccine to any poor pregnancy outcome. And then on the plus side, there have been a couple of studies just recently. There was one out earlier in April that found that actually when pregnant women or pregnant people were vaccinated, there was quite efficient transfer of the antibodies, the protection, to their fetuses. And so this is kind of how flu shots work. One of the reasons that flu shots are recommended for women when they are pregnant is because when the woman gets vaccinated against flu, she indirectly provides some protection for the baby, and the baby can't get vaccinated in the first 6 months of life. And so the preliminary information really looks good, that when women are getting vaccinated and they are pregnant, the babies are not only not having a negative outcome, but that they are getting some protection from COVID. And so, there's a lot of ongoing studies related to this. I'm sure people may have additional questions, and always I refer you to your OBGYN if you're pregnant and you have questions about the vaccine or your particular situation. But broadly, really good news coming out in the scientific literature related to the COVID vaccine and pregnancy. Brendan Nieves Lebron on Facebook. What's going to happen to our students that are under 16 years of age when school starts in the fall and the vaccine is only authorized for 16 and over? So probably, I do think the vaccine probably will have authorization, like I said, for those between 12 and 15. But regardless, we will be working to vaccinate everybody for who is eligible, and we will be continuing with the masks and distancing and a lot more testing availability in schools, making them as safe really as they can be for when we're back in the fall. But we'll be working hard to make sure that as vaccine availability is there for younger kids, that they get vaccinated. Alexandria Dean is saying, I'm getting my second shot tomorrow. I've heard a lot of people who got Moderna had strange sounds in their stomach. Is that normal? I also feel like my friends who got Moderna had more side effects than those who had Pfizer. Is that a trend? Glad you're getting your second shot tomorrow. So would you like to know the medical word for strange sounds in your stomach? It's a fun one. It's called borborygmi. Borborygmi is the medical term for like rumbling stomach. And I would not think that that is probably related to the vaccine. And if it is, we saw a small number of people who had a little bit of maybe some GI upset after getting any of the vaccines. If you did not have that after the first vaccine, I think it would be unlikely that you would have it after the second vaccine. And even if you have it, it's not a sign of danger. It's not a sign that there's any problem, and it's not something that I would worry about. I think. And then I don't remember what the second part of your question was, but it was basically asking, I think, I remember. Was there a difference between Moderna and Pfizer? And, broadly, you can look at the charts, but the biggest predictor of whether people have a side effect after vaccine, actually, the biggest thing is due to age. Older people broadly do not have as much side effects, and that's because their immune systems are not quite as robust generally, and so they don't mount as much of a immune response. It doesn't mean that they're not protected. It just means, those side effects that people are having, they're not dangerous. That's not you getting sick from COVID. That's just your immune system learning the lesson of how to fight it off. So people who have stronger side effects, it's just a sign that you have a very robust, strong immune system that's learning the lesson, and age seems to be the biggest predictor there. So I would not try to make a decision between between Moderna and Pfizer in particular based on side effects. I think get the one that's available to you, and do definitely get that second dose. We also see that people, the biggest predictor between first and second doses is what your own reaction was. So if you didn't have much of a reaction after the first dose, you're unlikely to have a big reaction after the second dose. We do see people having a little more side effects after the second dose than the first, but usually not a huge amount of difference. Johnson & Johnson broadly does have a lower rate of the side effects in those first few days than the other two do. But broadly, in all cases, many people don't have side effects at all, and happy to take additional questions there. Tamika Johnson Peterson, my son has several food allergies, including allergies to shellfish, peanut butter, and eggs. At one point, I was told he couldn't have the flu shot because of his allergies to eggs. Do you know if the COVID shot has side effects for those with food allergies? Great question. So, as always, I'm going to refer any individual to have a conversation with their doctor. But at the highest level, there is not a concern generally for people who have food allergies with the COVID vaccine. Your son would have been told maybe to avoid some of the earlier flu vaccines with eggs, because a traditional way of actually making flu vaccines uses eggs, and there can be a sort of a side effect from that. It's actually not the way we make them so much anymore, but that's some of where that comes from. There is no use of eggs. There is no use of any of these things that are known to trigger allergies. And so the only allergies that really the CDC calls out are the very unusual case of people who have an allergy, and like a serious allergy, to one of the components of the vaccine. So what we've been telling people is if you've had a serious allergic reaction, like you need to carry an EpiPen to an injectable medication or to a vaccine, talk to your allergist. But generally, for people who have food allergies or bee sting allergies or environmental allergies or other medication, penicillin, oral medications, those are not contraindications, meaning you generally can and should get the COVID vaccine. So if you've got a really serious history of allergies, I always encourage people to talk to their allergist or their doctor, but your son should absolutely be able to get the vaccine based on that history that you've reported there. Okay. So I think we are actually just about out of time. I know we started just a little bit later here. Let me see if I can hit a couple of these real quick. Brian O'Shea on Facebook says he lives in a condominium downtown. Is it safe for the building to open the fitness room? It is. You're going to want to make sure that you're, again, a lot of this has to do with are people vaccinated, but broadly, yes, it is safe to have it open. Probably your building will want to have some limits in terms of how many people can be in there. Be making sure, we are still recommending, unless you're, maybe the only person in there, that if there are multiple people in a space, in a gym, that masks should still be worn. But yes, I am in favor of buildings having their gyms open with some precautions. And there's more information online if you want to know some more about that. I think the last one we'll take here is Valdastatin from Facebook. If I had no side effects with either Moderna shot, should I be concerned? And do I keep getting tested after I've had my shots? So you should not be concerned. I love that question. No worries if you had lots of side effects or if you did not have any side effects. It doesn't say anything about whether the vaccine is protecting you. It just lets you know sort of how robust that immune system is. I didn't have a lot of side effects either after either of my doses, but I'm not worried that I don't have that protection level. So no worries. And to the question of do you need to keep getting tested after you're vaccinated? You don't, unless you're having symptoms. It's very unlikely, but not, even the best vaccines are not 100% protective, and that's this breakthrough infections. We've been tracking it. We have had a few hundred Chicagoans that have been diagnosed with these breakthrough infections. We put out a report about what we'd seen in nursing homes related to that, and we can talk more about it if you like. Very small percentage, less than 1% of the people who we've been seeing getting vaccinated are then having that breakthrough infection, but it can happen. So you don't need to be getting tested if you are fully vaccinated 2 weeks post the second dose, unless you're getting symptoms of COVID or you have, another concern, then you can get a test. And the good news is you can now get a test over the counter, $23.99 if you want, at CVS or Walgreens or Walmart. You can get it online. Our testing sites remain open. Providers have testing opportunities, and there's more and more testing opportunities. But generally, if you're fully vaccinated, you should feel confident. And that's why the CDC put these recommendations out, right? That you getting vaccinated is your ticket to being able to get back to the things that you love doing. And the sooner you can do that, everyone in your family can do that, and ideally everyone in Chicago can do that, the sooner and more safely we're going to be able to get back to doing the things that we all love. So thank you everybody for chiming in today with questions. And we do have a press conference, like I said, at 1 o'clock today, just with some more details related to vaccination efforts and giving some additional updates. And then I'm not sure if we'll be on Thursday. If we are, we're probably going to have to move the time just because there's some other events and things happening, but we'll post. And as always, if we didn't get to your question, we will try to be putting it in the frequently asked questions on our website. And really thank everybody for their attention, and take the opportunity to reach out to a friend, a neighbor, an older relative, and say, are you vaccinated? And if you're not, can I help you get that vaccine? Please. Best thing you could do right now is help get everybody vaccinated. Thanks. We'll see you back sometime soon.